Two special tests we can look at. Firstly, to check out the iliotibial band, we can bring the leg back into the flex position and tuck it under the arm. Line up the shoulder, the hip and the knee, and the aim is to gently loosen the hip and try and let the knee drop. If it only drops a small amount, that is indicative of a very tight iliotibial band. If we try and lower it down, ideally the knee should be able to touch the couch. If it can't, then you can see that the band is relatively tight. The other test is Thomas's test. In this, the patient sits back and then lies back onto the couch, pulling one knee towards the chest. If on the opposite leg the knee is high and the thigh is off the end of the couch, this will indicate a tight iliopsoas. If the knee is relatively straight and normally would be about 100 degrees, then this would indicate a tight rectus femoris. Unrelated deep pain in the hip or groin may well be referred from the back or from underlying structures in the pelvic area. These would have to be investigated by a medical specialist. From a soft tissue point of view, we can get problems with the main muscles that control the hip and thigh. At the side we have the tensor fascia lata and related iliotibial band, coming right down towards the knee, and at the back we have gluteus maximus and strains to the hamstrings. At the front we have rectus femoris, the iliopsoas muscle, and coming down to the quads themselves. There are also bursas which can become inflamed under the iliopsoas itself. On the side there is a bursa sitting underneath the gluteus medius and minimus, and to the back there are bursa sitting underneath the origin of the hamstrings. The most common injuries are to rectus femoris, the hamstrings, and on the inside the adductor group.